The second line therapies that the AUA recommends are medications. These are all the commercials that you see on TV where the lady's following her bladder around and she knows where every bathroom is. When I got out of training, we only had 2 medicines available to us: oxybutynin, which is ditropan, and Detrol, and some of you may be familiar with those. So I tried one. If that didn't work, we tried the other, and we were done. We didn't have guidelines back then. We didn't have a lot of medicines to choose from. We're now very blessed that we have a laundry list of things that we can help people with. And as far as the medications go, there are about 12 or 13 that are FDA approved. They do work very well. The trick is finding one that the insurance company will pay for and that you have minimal side effects from. Most of them have very minimal side effects these days, so we can usually find something. The primary side effects of most of the overactive bladder medicines are constipation and dry mouth, but those are of the anticholinergics, which are the Detrol, Ditropan, Sanctura, Enablex, Vesicare, Toviaz, if any of those names are familiar. There's a newer agent out which blocks a completely different receptor, and it's called Mirbetriq, which does not cause those side effects. So if you've ever been on a medicine and it caused those side effects, we do have newer medicines that do not. Our recommendations, or at least my recommendations when somebody comes into the office, I tell them to do one of 3 things. My best recommendation is to do steps 1 and 2 together. Do pelvic floor conditioning along with some lifestyle changes and a medicine. And the reason I recommend doing both is that we're working at the problem from 2 different directions and we get results faster that way. And let's face it, we are all in a microwave world. We want everything fixed yesterday. Even though this problem's been going on for 3 years, they want it fixed right away. So the quicker I can get results for patients, the happier they are. That doesn't work for everybody. Some people feel very strongly about not taking a medicine. That's great. Do pelvic floor rehab. Work with your own natural tissues and make them stronger. That will help. Some people logistically can't get to the office. That's fine too. Choose the medicine. But whatever you choose, you have to give it time. I tell people that this is a process that we're going to work together over a couple of months to make improvement. For example, if I put you on a medicine, I'm going to see you back in 4 weeks, and at that time we'll decide whether to increase the dose, change the dose, add something to it, or go on to the next step.